Hello, everyone, and welcome back to Psychology Eats. So, what's eating you? Psychology Eats is here to help you. What's eating you? Hello, everyone. Hello to all my old subscribers. Hello. And anyone that is new here, welcome. I am Psychology Eats. And what I do over here is what I do over here. I talk a little bit of no. I give my opinion about things that are going on in the world, that are going on YouTube, especially in the sector in which I belong, which is, I'm going to say, the black mukbang sector, the tea side of it. I'm in the tea side. The reacting side. So I do reaction videos. And today, you read the title. I'm talking about Dalvin. Now, Dalvin, I've done a couple of videos on you. We cool. I don't use Dalvin's content because he don't play them games. And I respect that. So Dalvin did post a video where he said that he's considering that he may go see a therapist. And obviously, when I saw that title, I clicked right on it. I got to be honest, I kind of looked at it a little bit, stopped. I was all over the place, I think, when I tried to watch that video. But what I'm about to do now is talk about the importance of mental health. If you followed me or if you know me, you know that I am a 30-year vet in the field of mental health. When I first came in, we weren't even using that term. It was like social services, human services, mental illness, But the umbrella is mental health. And so I am a therapist. It depends on where you live. Sometimes my position may be called a psychotherapist, a clinician, a mental health provider, whatever. It depends on your state. But at this point in my career, I've done that for a long time. I've moved into academia. And so now what I do, excuse me. Oh, my goodness. What I do now is I am a psychology professor at a few different colleges. And so that is what I'm doing now. I am teaching, I like to say, the youngins who have a desire to be in the field of psychology, the basics of what psychologists do, clinicians do, social workers do, and psychiatrists who are medical doctors. And so I know the general public sometimes will get confused about that. But Dalvin, this video is for you and anyone else who is considering going into therapy. And the one question I would ask is, what's going on? Like, what's going on? I know you recently had a breakup, but you've had breakups before. So what makes this different? And what makes you think you need to seek therapy? So there are multiple. Another thing I want to make a point of, what I do also is consulting. I do consulting where, like someone like Dalvin, or they may not know exactly what they want or what they think they might need as far as mental health services. And so I will give you like that initial contact person in the field and just ask some basic questions about what do what do you think, what's going on, some other questions I'm going to get to try to kind of see where you are and what you might need in the field. So, one basic assessment that you can take that I give people is a quick assessment. It's called how is your emotional wellness? Now here it is. I know you see that. That's that chapter I cover when I do this emotional wellness. But I'll leave. This was written by a licensed therapist. Her name is Judith Belmont. And I use Judith's assessment because it really is just a kind of a quick assessment. And it's asking the person 5 or 10 basic questions. And then afterwards, you add it up, you score it. And if you get below 15, then you need to seek out professional wellness. So I'm going to screenshot this so you can take this test guide yourself and see if you need professional help. One of the questions is, I feel satisfied with who I am and where I am in my life. So, and then you answer strongly agree, slightly agree, whatever. Everything is numbered, and then you're going to add it up. Some people might look at Dalvin's life and say, you got everything. You got an easy job. You come on camera, you eat for 15, 20 minutes. Prior to that, yes, I know there's setup and all that kind of stuff. But you got a pretty easy job and you make a lot of money. And your parents are rich. Why you upset? What's wrong with you? Right? But we know that people can have millions of dollars, zillions of dollars, and they will still can be depressed, anxious, and have some mental health struggles. So money and your position in the world or in the community doesn't negate the fact that you could still have mental health issues. So maybe he's not satisfied with his life. I mean, he just had another breakup. That is a reason to not be satisfied with your life. Another question is, I do not hold on to grudges and I can forgive others for not living up to my expectations. All of us may have a little struggle with that, right? Ellie, you came in my life, you were supposed to fulfill these things and that didn't happen, right? So maybe, Dalvin, you do need to see somebody, but this is just I'm giving you an initial free evaluation, right? That can fit for anybody, honestly, guys. So that would be the first thing I would do as a consulting with him. Let's determine, okay, so now we've determined, yes, you need to see a therapist. I would suggest, my recommendation is that you should see a therapist. So then I would say, do you prefer in-person therapy or virtual? Now listen, I'm new to virtual. Virtual kind of happened for most of us in the field because of COVID. And initially it didn't feel comfortable to me. I like the office setting. Okay. Many clients prefer the office setting, but there are some clients who prefer virtual. It works for their schedule. It's been 2 years now. Although I'm not practicing, if I had to do virtual, I could do it. I did it a little bit back during COVID. Even teaching, I didn't think I could be a virtual professor, but I can. I actually had started liking it better. But then I was like, no, I got to get back to the classroom. Um, for me. But because I had was pushed into it, I just learned to deal with it. All right, let me get back to you, Dalvin. All right, so do you want to do in person or virtual counseling? Okay, because both are available now. Now, let's talk about, do you need to see a licensed person? So, normally your choices for a therapist are going to be a licensed professional counselor, which I prefer, um, a licensed social worker, or a licensed psychologist. There are some psychiatrists that do talk therapy, but most do not. Most do not. They are the people, they what their positions are is to prescribe medication. So they don't do like the talk therapy. So those are pretty much your choices. Or you can get a therapist who is not licensed and they pretty much work under the license of someone who is licensed. So they're not in the office with, they're not in the session with you. That's billing. That's for billing. And that's for billing. Um, so it's up to you. Um, I wouldn't say one is better than the other because I do have a video out how to find the best, a good therapist. I'm gonna show you. I'm gonna try to link it, but if I don't, I'm just show you the picture and then you could go there. But that's another thing. Licensed, not licensed, it depends on your state. I don't know what's happening. I think you live in Texas. I don't know if Texas is all licensed up. I don't know. Where I live, we're getting there, but we're not there yet. I could do a whole nother video about that, but that's stuff that's going on behind the scenes professionally. Um, do you prefer a male or a female? That's another good question. I would ask as a consultant trying to help you to find and navigate your way in the field. By the way, anybody who's interested can join my second tier membership. It's called Intern Psycho. And I do this work there. I give those members will have a 45 minute monthly assessments with me, life skills, life coaching. I'll go over some of this, like where are you, do I need to tap you into a therapist? What are you looking for? That sort of thing. So, yes, Dalvin, back to you. Do you prefer a male or a female? That's important. That's important because you're going to go in thinking, one way. If you're like, oh my God, I don't want to talk to a woman, it reminds me of my mom and I don't want that kind of energy. I'd rather have a guy. It's perfectly fine. When you call to set up an appointment, you can say that. I really would like prefer a woman. Or I would really like a guy, right? The thing about therapists, like, we're not coming in with those kind of biases. So I'm not saying, oh, I want all female clients or I want all male clients, right? So it's a clean slate when you come in with a new therapist. So for us, it doesn't bother us if, in most cases, if the client is like, no, I'd rather have a guy, I'd rather have a girl. It's your choice. That's important that I would talk to a potential client about. Also, do you have insurance? Because we got to get paid. That's important. Listen. I've worked in many clinics. The secretaries dealt with that. but you didn't cross my door. You weren't in my office until the money part of it was figured out. Okay? So most of us will take a fee for service. Fee for service. That means cash. Okay? The average licensed therapist, depending on the state where you live, I'm going to say 150 an hour. About 150 an hour. Could be more if you're talking to a psychiatrist who maybe he does do talk therapy, or a psychologist. But I would say your average cost is going to be about that. Now, if you have insurance, I don't know any insurance company that does not cover mental health. Most insurance companies cover mental health. That's another thing you're going to need to do. You're going to need to call your insurance company and find out from them how many sessions y'all going to cover. How many sessions are you going to cover? And what is my copay? Okay. So once all of those questions are asked, and then oftentimes your insurance company will give you a list of providers that they have agreements with already. And so, you're just going to make your appointment. They're going to run the insurance. Ouch. They're going to get paid and everything's going to be great. So yeah, they already have that already established, most insurance companies. If you do not have insurance, then you're going to have to pay fee for service, or out of pocket, we call it. And like I said, that'll cost you about $150 or so. Get all that established. Now listen, everything I do is confidential. I know I'll be on here cutting up. But if you do seek out my consulting fee, or my consulting part of my channel, everything is confidential. You email me. The way you get in touch with me is through email, psychologyeats2@gmail.com. I will get back to you and we will set up either a duo call, a Zoom call, or just a phone call. And I'll go through, my questions and ask you some questions that we can get to where we think you should go. This is not just for Dalvin. Obviously, this is for anybody who is considering mental health treatment. Guys, I've been on here for 18 minutes. I probably lost you about 9-10 minutes ago. But if you made it to the end of this video, let me know by putting in the chat mental health. Just write mental health in the chat. Then I know you got to the end. Bye, guys.